More plates, more dates made you bald by suggesting to drink liquid egg whites. Actually, he gets credit for, he actually talked about a potential biotin insufficiency or deficiency if you very regularly do this.
Now, things not to eat if you want to get enough biotin. Egg whites. And this is something that I've actually done in the past. The pasteurized liquid egg whites, the super easy way to get more protein in. I think with cooking, you do denature the protein there, assuming that it's cooked thoroughly.
Yes.
But I have actually drank these liquid egg whites.
I remember seeing the More Plates, More Dates video on this way back, as probably 5-6 years ago. And I have also drank liquid egg whites.
And this is probably why a lot of bodybuilders are bald, right?
More Plates, More Dates made you bald by suggesting to drink liquid egg whites. Actually, he gets credit for, he actually talked about a potential biotin insufficiency or deficiency if you very regularly do this. Probably not why all bodybuilders are bald.
Other factors at play there.
Yep.
But yeah, it's a thing like don't do this in general, or check your biotin levels if you do. And probably don't do this at all if you have a known mutation. Yeah.
Speaking of mutations, if you had to have a metabolic disease, how does this rate? Like, I guess on a scale of 1 to 10, 10 being the most concerning, 1 being the least concerning, where would this rate?
So you said 10 being the most concerning?
The most concerning. Yeah, like Pompeii's disease.
Yeah, this is a 1 out of 10. I highly recommend it. And I found this paper titled Biotinidase Deficiency. If you have an inherited metabolic disease, this is the one to have. And again, metabolic disease, I don't think that I'm on the disease spectrum, but there could be a sort of subclinical deficiency there.
Yep.
And we'll go through some of the interesting points about that. So obviously, if it is a homozygous mutation, then these children and babies will require lifelong supplementation in order for normal development of hearing, vision, the neurological system to develop normally. So this says prior to treatment, concentrations of individuals with profound biotinidase deficiency may be decreased or in the low normal range. Isn't low normal still normal?
That's pretty debatable. I would argue any low normal value, lab value, warrants an explanation. Whether it is inaccurate laboratory assay, or whether it is poor lifestyle, or whether it is genetic mutation, one way or another.
Biotin supplementation.
Yeah, or biotin supplementation. So the lower it is, the more it makes sense to supplement. But for, I suppose, even for heterozygotes or carriers, why not supplement? What's the downside of supplementing? Slightly higher immunoassay biomarkers of certain sorts?
Yeah, and potentially adverse effects. So personally, for myself, I can't tell any difference in my day-to-day taking 10 million nanograms of biotin versus taking none. But some people, I think this is one that's notorious for causing some upset stomach or some nausea. I do take them usually after breakfast if I'm thinking about my day-to-day routine, so I don't know if that makes a difference or not. But in any case, I haven't had any adverse effects as far as I know. We'll go through some of the lab values in a bit. But this also notes that if someone is being appropriately treated, they're always going to have elevated concentrations in urine and in the serum. So that's not a reliable way to sort of track the disease state or if the treatment is correcting the deficiency. Unless I think there's something in there about non-compliance. So I suppose now that my doctor will be checking my biotin levels to make sure that I'm compliant with my supplementation.
Maybe not. What does it mean by enzymatic activity? It says you should track enzymatic activity to see kind of where your phenotype is. Because usually when you check an MTHFR, you just see if you have, 1 or 2 mutations, and then you don't worry about how much that is doing, or do you?
Some people do.
The answer is yes, you do. And we'll link our MTHFR podcast below, where we also kind of talk about enzymatic activity, which we measure by proxy with homocysteine and methylmalonic acid levels. But I did think that it was interesting that it mentioned that this is kind of the the gold standard for which to base treatment decisions by.
Yeah, because the genotype doesn't always match the phenotype. So the phenotype is, hey, we've got this enzyme measured in the blood. What is its activity level in comparison to what we'd expect? Is it 10% of what we'd expect? Is it 60% of what we'd expect? So I'll have that test done and then determine whether I need to take a biotin supplement.
Mm-hmm.
But in the meantime, I think it's reasonable with very little downside and no perceivable side effects to continue with supplementation. There's a little bit of information about carnitine, which I find kind of counterintuitive here, but there's a lot of biochemistry there. So probably a PhD in specifically like biotin metabolism or carnitine metabolism would be able to tell us more. But there may be some concern for carnitine depletion in people who are biotin deficient, whether that's by malnutrition or by having a mutation in the enzyme.
Yeah, or potentially less synthesis of free fatty acids or a less processing of free fatty acids. I think inborn error of metabolism, especially with triglyceride level variation, carnitine and shunting fuel into the cell, and not just into the cell, into the mitochondria, is kind of one of the first empiric treatment mechanisms I think of, especially if there's hypertriglyceridemia.